Maine is facing what many are calling an EMS crisis. In December 2022, the Blue Ribbon Commission released a study of emergency medical services in the state. It found communities all over the state are struggling to recruit new workers while also trying to retain the ones they already have. Part of the problem is pay. According to the Blue Ribbon report, emergency medical technicians, or EMTs, make on average between $29,000 and $36,000 a year. And it's not much better for paramedics, who make between $39,000 and $53,000 a year. The shortage of EMS workers is being felt all over the state and the country. But one EMT in Indiana is taking an extra step to help bring down the number of 911 calls in the area. She's doing it by working full-time in a homeless shelter. NBC's Zinklea Zimwa takes a closer look.
Are you able to sit up at all that
It's around 9:30 a.m. in Indianapolis.
What's her name?
EMT Alicia Dinkeldine Warren is mid-conversation when she's pulled to administer aid.
Do you know what today is?
Alicia works full-time at the Wheeler Mission Homeless Center for Men as an embedded emergency medical technician, or EMT. Her work is needed as there's a nationwide shortage of emergency medical services, including EMTs and paramedics.
You all right?
We've seen in the state of Indiana over the last 5 years more paramedics leaving the field than are entering the field.
It's a national trend. A federal study projecting a need for 40,000 more full-time emergency medical personnel from 2016 to 2030. To become a certified EMT, individuals must pass a national certification exam, including a fitness test. Paramedics require additional education and training. To address the need, some communities are incentivizing prospects, offering thousands in scholarships for paramedic training. Alicia hopes her work at the shelter gives EMS workers in her community more bandwidth.
What that does is decreases the number of trucks that are running to that area and makes them more available for other 911 calls.
By embracing community paramedicine, Alicia is providing comprehensive emergency care outside the hospital setting.
I'm officially here now.
Assisting with scheduling doctor's appointments, picking up prescriptions, applying for social services, and more.
So I'm getting your medicine.
According to Indianapolis EMS, the shelter's 911 call volume, one of the highest in the city, drops 48% during the hours Alicia is in the building. For individuals like Charles Powell, it's been life-changing. 3 years ago, Charles suddenly became blind and lost his job and home.
It was scary. Real scary, not being able to see.
At the shelter, he met Alicia, who connected him with an eye surgeon.
They said I had cataracts. They said it's the thickest cataracts they ever seen.
But today, thanks to that medical care, Charles can see again and largely credits Alicia. The EMT hoping, amid this shortage, more frontline workers will return and work even closer with their communities. Zinklea Zimwa, NBC.